I don't know about Louisiana. I know here in the DC area, if you go to get your nails done at right, you'll see like a health and safety inspection certificate on the wall. They are subject to health and safety inspections by the state government. They are. And these organizations that are conducting transvaginal ultrasounds on women.
That's what I was going to say. That's what I'm saying. So they're going to say, like the reason for the nails is like, there can be infection. They're like jabbing into your cuticles.
They're working with like harsh chemicals, right? Exactly.
Yeah, right. But yeah, same with a transvaginal ultrasound. Like, there's potential
like completely
for
unlicensed, unregulated people getting clients into a room, getting them to, maybe take their clothes off.
And inserting instruments. Yes. Yep.
Oh my God.
What could go wrong? What could go wrong?
There are some states like, I believe Texas is one of them. I don't know about Louisiana. I know Texas for sure is one of them, where you have to have a specific kind of veterinary license to perform an ultrasound on livestock. But you don't have to do that to perform an ultrasound on a human woman.
That's probably true here.
Wild.
Wow. I'm sure that's true here. And that's
exactly. Up. It has to be true here. I mean, livestock that is more valuable than women in Louisiana for sure. There's no doubt.
Welcome to Seriously, the podcast that dives into the baffling.
We can't send them to a prison where there's animals, where there's livestock.
The ridiculous.
Like omelets better than sex.
And downright unbelievable political climate in red states like Louisiana.
So we can't go there. There are no vegan jails.
Seriously.
Welcome to Seriously. We're your hosts. I'm Michelle.
And I'm Ellie.
And we're having some technical difficulties. So if this actually even gets recorded and posted, it'll be a Hanukkah miracle today.
I'm also having some technical difficulties that I have a horrible cold. So for all my haters out there who think that I always sound like I have a cold, now you know what I really sound like when I have a cold.
Fantastic. We have a wonderful guest who we have rescheduled already, so we're going to make this work today. I'm super excited. I've known our guest for a little over a year, maybe 2 years now at this point. What is time? But we have Debra Rosen, who's the executive director of Reproductive Health and Freedom Watch. And she and her colleagues have been investigating unregulated pregnancy clinics or centers. We are going to figure out what the preferred nomenclature is. And a lot of that work has been tracking how they're funded, privacy violations of client data and things like that. So we're excited to have Debra on. So welcome to the podcast.
Thank you. Thanks for having me.
Awesome. Well, Debra, as you know, we like to start our show each week with our Seriously moments. As our guest, I would invite you to go first.
I prepared for this.
Oh, good. Okay.
I love a prepared guest because I'm always unprepared. Also, Debra, by the way, just so you know, I'm sure you already know, but like Michelle hates the CPCs or whatever we're going to figure out how to call them with like the hatred of 1,000 suns. So like, I'm so excited to talk to you. We are so excited to hear like all of your expertise. Like this is like one of like our/Michelle's favorite pet projects. So thanks for being with us.
Of course. I'm excited to discuss it.
Yeah.
Okay. Seriously. So, okay. It's not a political. Well, maybe it is a little political. Certainly. And I guess it's a bit repro. So my big seriously last week has been the Sean Combs documentary. Are you watching it?
No. Tell me.
My gosh. You have to see it. So the executive producer of the documentary, it's on Netflix. It's a 4-part documentary. The executive producer is 50 Cent, who had a long-standing feud with Sean Combs or Puff Daddy or P. Diddy. I don't know what he's called now. And I don't want to ruin the series for you or your listeners. Sort of share anything that's not in the public domain, but what's so fascinating about the documentary is there's all this footage of Sean Combs, like just footage of him
At the parties, at his own parties, I'm guessing.
well,
Yeah.
at his own parties. But the shocking footage is the footage of him like days before he was arrested in like his hotel room talking to his lawyers. Two things that are not really in the film that I think are really interesting. One, he was going to do a documentary, I guess, on himself. He was going to produce a documentary about his story. And he had hired a videographer who was just collecting tons of footage of him, talking about all kinds of stuff. And like things that, you know, I mean, some of the things that he says out loud are things that I don't know that I have the capacity to think, much less like say on camera. So he says all these crazy things and you wonder, oh my God, does he know he's being filmed? Yeah, he knew he was being filmed. And the reason
50
why.
Cent, but wait, this is fascinating. But like, so he knows he's being filmed. He thinks that he's doing this for like his own, documentary or whatever that like he can include or not include whatever he wants. And now he's right. Now 50 Cent like paid the videographer and got the shit. Is that the deal?
Yeah,
This
because
is
the
amazing.
videographer,
This is amazing.
videographer
didn't get paid by Sean Combs. Like he
didn't get
pay him.
paid. And he didn't have a contract, right? And so Netflix, like
oh
Netflix
my
is a
God, I love this. I love this.
Yeah.
Yes.
So imagine, like, you have this rival, you have all this footage of them just sounding psychotic. I mean, he sounds wild.
Oh my God. It's like, oh my God, I want to do that. I want to do this. Like I have so many frenemies / total enemies. I totally want to do this. We got to trick Ben Clapper into thinking that he's making a documentary about himself.
Yeah.
And then I'll pay the person and then we'll do the real untold story of the Louisiana right to life. Amazing.
Oh, yeah.
Oh my God.
Ben Clapper is our listeners will know this. Ben Clapper is the director of the Louisiana Right to Life, just to put that out there.
Right.
Yeah. That's wild.
I remember seeing him at the state capitol when I was there last year.
I'm sure you did. Yeah. No, I would have been, all the shit, all the, P. Diddy shit is crazy anyway, but you have 100% piqued my interest. I'm going to watch the whole thing. It's on Netflix. All right.
It's on Netflix. It's a 4-part series. And now, I feel stupid saying like 50 Cent, but that's what I guess that's the way you pronounce his name.
Yeah. Yeah. He was big when we were kids, Debra. I don't know how old you are, but yeah, back when I was in law school, he was a real star then. Yeah.
Mm-hmm.
Oh yeah. Yeah. He went on a talk show this week and talked about how like he actually has there's more footage that, he just had so much information to cram into a 4-part series. So there may be a second release. I know that Sean Combs is suing him. And Netflix.
Yeah, that's right.
But yeah, it is. It's fascinating. And then like the soundtrack is really great too. It's all the music that we grew up with and the stories about his involvement in not just, there's certainly the sexual assault is outrageous. His involvement in Tupac's murder is explored. Wow. His involvement in Notorious B.I.G's murder. It's crazy. I highly recommend it.
Wow. He's clearly Sean Combs, whatever his million names are. He's clearly a sociopath. He's also a really incredible businessman. Again, with the millions of different names and different iterations. So yeah, there would be a lot to explore.
Oh yeah,
for sure. Wow.
All right, good recommendation, and also seriously, pay the people that you contract.
That's
like
right.
Moral of the story.
Have a contract.
Yeah, all of the but you have a contract. Really, the paying them though is even with the contract, you didn't get paid from that person. Yeah, this is like the Donald Trump problem too. Never pays people.
Yeah, which is
work
crazy.
For him.
Yeah, it's crazy that more stuff hasn't come out on Donald Trump, given the number of people that have been around him that probably haven't been paid.
In terms of, from my perspective, the problem is that it's a lot of lawyers, and so we're still bound by confidentiality with attorney-client privilege. But That's why, like, back in, like, Trump won, like, he couldn't find any good lawyers to represent him. Every firm was declining representing him because, like, he was notorious for both not paying his
Yeah.
lawyers and not listening to their advice, which, like, as any lawyer knows, that's like the double whammy. The double whammy of a client that, like, you do not want is somebody who won't pay you and won't listen to you. So, yeah, but unfortunately, those people are all bound by confidentiality. Actual ethics, unlike a videographer.
Amazing. Ellie, what about you?
I don't even know my seriously is. Like, it's been a while since we've recorded live, so, like, so many things have happened, and also, like, I'm just, like, I've no idea what's going on. Like, I've been sick, I've been out of town, it's been the holidays, blah, 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 blah. But Deborah and I were talking about before we started the New Orleans, the ICE has actually come, Customs and Border Patrol, whatever, is actually landed now in New Orleans. So I think that's, like, the biggest seriously for me. Like,
Well, the
it
seriously
hasn't.
is what they're calling this,
Oh, I
which
know.
is
Catahoula Crunch and the
yes.
Bayou Sweep or whatever. It's yeah. It was.
It's so stupid.
Well, but not just that. Like, Troy Carter actually put out a really good statement about this at the beginning, which it was also, I think, in relation to, the one in Charlotte, they called Charlotte's Web, is that, like, there's nothing, like, cute or funny about what's going on with
True.
any of this. And, like, that's what all these names are like that. They're kind of like, tongue in cheek, like, kind of like cute, funny, like whatever. Like, it's not cute, it's not funny, like, as this is, like, incredibly, like, damaging to families, communities, the rule of law, all of those things. So, like, it's just disgusting, actually, like, those whatever names. So, yeah, I mean, I don't really have that much of a sense of what, I don't know if you do, Michelle, about, like, what is going on so far. I know that, like, there were, like, a couple of, like, disgusting, like, showings of force, blah, 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 just basically parading around with the Bondino guy in the French Quarter. And mostly they're centered in, as far as New Orleans, like, out in Kenner, which is
And
where,
Kenner, yeah.
yeah, which is where the airport is for folks who don't know, and where the majority of, like, the Latino population and, like, the immigrant population, it's just, like, right outside of New Orleans, the suburbs right outside. So that's where they are. It's all really gross. But I mean, it's sort of, I think, like it was in DC at the beginning, where, like, people, when you would talk to regular people, they would be like, I'm horrified, this is horrible, but, like, I haven't really seen anything yet. That's sort of how I feel right now.
So they've arrested, or this was, this could be a little bit old, but a couple of days ago I checked on this. They've detained 38 people. Only 9 of them have criminal records of any sort.
Shocking.
Yeah. So, it's not like there's, thousands and thousands of people that they're catching
Well, there
in
aren't.
the crunch.
Right. Well, that's also part of the crunch is also, like, broader. I mean, I have some, like, clients and folks, like, who are in nearby parishes who, it's broader than just New Orleans. But, like, part of the bullshit with all of this is that, like, compared to other parts of the country, there's not tons and tons of immigrants here, period.
Mhm.
The only reason they're here is because our fucking governor wanted them to come as just a purely political matter. So, like, yeah, there's not that much to do here, which also
Yeah.
makes it even more dangerous in terms of, like, who they're going to start trying to, like, gotta do something, gotta find somebody. So, yeah, I don't know. It's all very
It's disturbing. And I
Yes.
don't know if you have noticed this, LA, like, just driving around the city, all the taco trucks are gone, like, all of them.
Yeah.
They're
I mean, I
all
know
gone.
a lot of restaurants have shut down too. I mean, like, ones that are run by Hispanic folks, like, just because they don't want to put their workers in danger, whether they're documented or not.
That's the kind of energy I feel like New Orleans is bringing. And
Well,
also,
and I mean, quite
there
frankly,
had been this
yeah.
whole thing of, like, showing up where ICE was and blowing whistles. That's been a thing
Yes.
that's been
Yes.
happening. And, like, in New Orleans, like, we have better instruments than whistles. So people are showing up with, like, trumpets, trombones, sousaphones. It's awesome.
I love that. So, one question I have for you, and if you don't know this, then we don't have to put this on. You can tell me separately. But like, my sister was asking about. So, as we know, then, like, in like in Charlotte, kids stopped going to school. It's
Mhm.
hard for people to like go to the grocery. Like people are just, really worried to leave their homes. Another reason that this is so immoral in New Orleans is that there only became any sort of a large Hispanic population here at all after Katrina, because those are the people who came here to help fucking rebuild the city. So I think that's like
Yes.
really important for people. Like there were no, I mean, I lived here before Katrina, so did you. Like
Yep.
there was basically no good Mexican restaurant in the whole town. There was no like, like any other sort of Hispanic restaurants, and not like any significant population. It was basically white people and Black people and Vietnamese people. So the Hispanic population people only came here to fucking rebuild the city. And this
Yeah.
is now what they get in return. Do you know of any organizations that so Blair was like thinking about trying to donate to people who are doing like direct assistance to immigrant families who feel unsafe, like with like
It's a really good question, and I'm
yeah.
sure I do.
Okay.
I'm not going to be able to pull that out of my brain at this moment, but
That's fine. Yeah.
we'll do a little rundown at the end of the show, and we'll put it in the show notes.
Perfect. Okay. All right. That was a long riff on that.
Yeah.
Ill prepared.
No, it's
Seriously.
good.
Go ahead. Yeah.
So I have a
Whatever else
weird
you
one
have.
today. I have a weird one today. I was digging around on Substack, which I don't do very often, but I do when I'm looking at like what, I'm like reading Jessica Valenti or JVL from the Bulwark.
Yeah.
And I've came across this great article, and the title is so awesome. And I think both of you will recognize yourselves in this. Aging Out of Fucks. The neuroscience of why you suddenly can't pretend anymore. And so
Yes.
yeah, I know, right? So this article is like really kind of looking at the biology and the neuroscience about like how at a certain age your brain starts to restructure itself. And I think this is so funny because I've always been like, I am really looking forward to being like that
Yes.
incredibly bitchy but funny old Jewish lady that's like always complaining that it's too cold everywhere she goes, and like she's just so fucking mean but hilarious, and also really, like caring and warm and kind when she wants to be. Like that's my retirement plan, essentially. A
That's
little
funny
bit
because I say, I don't think we've ever talked about this. I say the same thing, but my vision is totally much more like dark of myself. I'm like, I'm looking forward to being like the crazy old lady at the grocery store that can just do whatever the fuck she wants. And people are like, okay, all right, okay. So like you're of course like, manifesting that you're going to be like nice and kind and still sane. I'm not.
but I'm going to be
I'm
I'm just
manifesting. I'm going to be
complaining a lot,
old and
complaining.
yeah, old, crazy, and bitchy, and like you're like, oh no, that's just Miss Ellie, we just.
I don't know what the science is. I'll say this. Like, I feel like I'm at a point where I live in DC, and I'm at a point where it's not that I'm not going to be polite or respectful, but I'm not going to hide from you that I disagree with what you're saying. And I think that confronting people is important, particularly now. It's probably always been, but really now it's important. And if you don't like the way I think about something, you don't like my politics, I don't want to spend time with you. I don't want you in my space.
Yeah.
So, yeah, I don't know what your cursing
Well, let me tell
you
you the science. Okay.
Okay.
So, Dr. Luann Brizendine, who's a neuropsychiatrist, she wrote a book called The Female Brain, which now I kind of want to read.
Yeah.
So she was explaining that women's brains are particularly wired for social harmony, caregiving for the first half of their lives. And then that is driven partly by estrogen and like oxytocin. As we get older and our estrogen levels shift in perimenopause, menopause, this intense drive for like pleasing people and nurturing people like begins to fade. And then we just don't give a fuck anymore.
I love it because I was just going to say, when you were saying about aging in general, I was just about to say this seems particularly true for women because, like, like women are sort of notorious, and we all know it from our own lives for yes, like wanting to, be assertive, but like kind of it's
A
it's
people
hard
pleaser.
and society does not reward that. I mean, society does not like it when women are talking back and, speaking up. So it also, gets sort of like born into us in so many ways. But yeah, this is super interesting. I want to see this article.
Yeah, I'll put it in the show notes. I'll also
So it's like
email
we're
it to you,
becoming more
Ellie,
like men are all of the time, but basically,
all of the time.
yeah,
Right.
yeah, that's just like from from birth on. Then they don't give a fuck. This is just that it takes women like into their 50s to be like, oh wait, like yeah, no, I also don't give a fuck.
Mm-hmm.
And a biological change.
Yes, that's right.
Yes.
Right. I guess
I
there
don't
has
have
to
to
be
be-
half of the
yeah.
species that are trying to get along. So,
Yes.
thanks. Thank you, society.
Anyway,
Otherwise, we would have gone extinct a long time ago. So thank you that it takes
100.
us until we're in our 50s to stop giving a fuck. Yeah.
I know. And just think, like, 100 years ago, the poor women that didn't even live long enough to get to this point, Yeah. Oh my gosh. Okay. Well, let's jump into our topic for today. So, our listeners and YouTube viewers know that we have talked about these unregulated pregnancy clinics, centers, whatever, lots of times because I hate them. And we're doing kind of a couple of episodes on them just because there's just an immense amount of bullshit that they're doing that we can talk about. Last week we cross-posted an episode from Repro's Fight Back where they talked about some other research being done into these centers. But I wanted to talk about the work that Reproductive Health and Freedom Watch is doing because I think you brought something to me, Deborah, when we met, those many months ago that I hadn't really thought about. And so that's why I was so excited to bring you onto the podcast and let you share your knowledge with other people. But for listeners who may not know, what is Reproductive Health and Freedom Watch and what do you guys do?
Yeah. So Reproductive Health and Freedom Watch is a nonprofit watchdog organization that investigates the sort of sprawling, I would say largely hidden network that's shaping reproductive health policy in the United States, in local, in state, and federal arenas. We are really focused on rigorous research, producing public interest investigations, supporting policymakers, journalists, advocates with evidence with actionable evidence that exposes how this infrastructure operates. And our work really bridges policy, law, and public health with the objective of ensuring that reproductive health services systems are transparent, accountable, and really grounded in real medical standards.
Awesome.
Interesting. Do you guys also work then on like issues about like the funding for that whole apparatus, like writ large beyond just the CPCs?
Yeah. So the reason why the CPCs really, or as we refer to them, unlicensed or unregulated pregnancy clinics, the reason really, how they emerged on our radar was we were conducting an analysis of, what is this sort of anti-choice, pro-life? What is this movement? Who are the organizations in this movement? How is it funded? How do they work with each other? And as part of that, we did a massive analysis of the finances that really propel this movement. And in that exercise, we gathered these sort of tax returns for nonprofit organizations for about 3,000 organizations across the country that file with the IRS, that are engaged in some sort of anti-choice policy work in the country, and found that this network is really where the bulk of the money is. And when I say that, I mean, we're projecting that the unregulated pregnancy clinic industry will raise about $2.5 billion with a B dollars in 2025.
Wow. So, okay. Number one, I think we should do a separate show about the network and funding beyond CPCs, because I would be interested in that, like that,
Oh, yeah.
and how the C3s and the C4s interact and who's funding who. That I think is really interesting. But beyond that, well, maybe number one, you can tell us why you guys call these clinics like unregulated or unlicensed, or what the sort of like logic behind the nomenclature is. But the $1 billion, why is it that the clinics, that the centers are the center of the fundraising or the fund giving,
Yeah.
the fund having?
Yeah. So, okay. So there's two questions. So why do
Yes.
we call them unregulated pregnancy clinics? In our work to hold these centers accountable, we actually wanted to sort of better understand, what language is most descriptive for reasonable people, voters, whether they're Democrats, independents, Republicans. What is the best way to describe what these organizations are, right?
Right.
Because there's been a lot of terms that have been used, right? Crisis pregnancy centers, fake clinics.
That's what they call themselves. They call themselves crisis pregnancy centers, right?
Well, they used to. Now they call themselves
Pregnancy resource
pregnancy
center.
help. Yeah,
Okay.
pregnancy resource centers. Yeah, or pregnancy help organizations. They're really they're. I would say this year there seems to be a bit of a push to move away from names that would suggest that they are medical, which we can talk about. But it's really a legal move for them. So we did a series of focus groups, and in a room with people who were who were all voters, registered voters of different parties, described what these organizations are and what they do. And the people in the room said, and we'd asked, what would you call that? And people in the room said, well, it sounds like an unlicensed pregnancy clinic. I'm like, yeah, it does. It does sound like that. And we tested that in follow-up polling and found that was actually the most accurate way of referring to what these centers are. And then sort of made the shift to say, this is how we're going to refer to them. Because these other, what we found in the polling and focus groups was that crisis pregnancy center sounded like a good thing. And then fake clinic and anti-abortion center was not particularly effective with the majority of voters.
It sounds super partisan. It
riles up the base, but it doesn't.
Yeah, right. But I mean, if I whatever the whatever the thing would be on the other side, if I heard them say that, I would be like, it would immediately put up your spidey senses of being like, what? Like,
oh
yeah. But in terms of unregulated or unlicensed, that's kind of interesting. Like, I don't know. I mean, to me, then I think unregulated maybe is better. Like, unlicensed is like, I don't know. I mean, I guess it really depends on probably people's profession, whether being licensed or unlicensed sounds bad. But licensing is like, it can be such a stupid bullshit. Like in states like Louisiana, I think most states, there's so much regulatory crap. Like if you're a hairdresser, you have to be licensed. You have to be licensed to do almost anything.
To put together
in a way
a floral
that's so
arrangement.
Stupid. Yes, exactly. In a way that's just like beyond any logic and just is sort of anti-competitive and just like, really, I mean, I'm not a person who thinks that there's a lot of over-regulation. There is with this kind of crap. So yeah, I feel like unregulated is probably the best.
Yeah. And it sounds scary, right? Like true.
It's also true.
It's true.
As the benefit of being true, as we say in the law. It also has the benefit of being true.
No, 100%. And unlicensed, I think, the reason we really focused in on unregulated pregnancy clinics, the fact of the matter is there are a couple states that do have where unregulated pregnancy center clinics are required to be licensed. I think it's just Massachusetts and California right now.
Which also, to some extent, doesn't necessarily mean that they're particularly regulated. And again, I don't think that Louisiana is going in to investigate all the florists and the hairdressers, even though they're requiring them to get a license. So.
Right. Yeah. No, 100%.
Well, Debra, what do you think the biggest misconception is, like having done these focus groups and conducted a lot of kind of this public opinion research. Like, what do you think the biggest misconception is that people have about them?
I think the biggest misconception about them, and I'll tell you, I very early in my career, I worked at a reproductive health organization, gosh, more than 20 years ago now. And I would say that even among folks, some of the folks in the know, I think the biggest misconception is that these centers are like benign mom and pop charities offering support to pregnant patients. And in reality, they form a multi-billion-dollar national infrastructure that uses misinformation, pseudo medical services, data harvesting to influence reproductive health decisions. That's what they are, right?
Anti-abortion organizing centers as well, they're a recruitment tool for the people that are standing outside of clinics and harassing patients and providers.
Oh, absolutely. We did, one of the reasons why they came, it wasn't just the money that made them show up on our radar. It was also the connections that they had in the communities. Like we had an example of just one UPC in Florida where we had identified about 60 formal relationships that they had in the community. And I mean, businesses, service businesses, products, service businesses, legal firms, local, state, national organizations, legal media, a wide range. And just in the last year, and these are organizations that, when I say a formal relationship, I mean organizations that are sponsoring their events, right? These places are often the annual banquet for these places is in these small communities, kind of like a big deal. It's where everybody goes. And everybody wants to be seen. And so they have built out these networks. And so when you look at these networks, it really sort of gives you, for me as an organizer, and I would say that like deep in my bones, that's what I am. I am an organizer. So when I looked at this picture of this one tiny little seemingly small organization has relationships with all of these local businesses, state businesses, media, all these different places, it really sort of helped. I had this aha moment myself. I was like, oh, okay, this is a base of power in this community.
Which also,
Big
like, it's like, it's somewhat surprising. I mean, it's not surprising because of the money part, which I want to ask you about in a second, but like, it is sort of surprising because in reality, these centers, whatever you want to call them, they don't do that much. Like, they really don't.
No.
Like, I mean, that's, whatever it, whether you want to put it in the, positive or negative, they don't. Like, they don't provide very many services. And the number of people that they serve, that depends. But like, if they're tricking people to come in or people are coming in willingly, but like, regardless of that, like they're doing some ultrasounds and maybe they're giving out some diapers, depending on the place. Maybe they're referring people to some other social services, depending on the place. And that's basically it. So they're not doing very much, like as opposed to other organizations that would have the level of connection that you're talking about. But so my question though, like, I know here, and I know this is true in Texas, I'm sure it's true other places, but it's sort of fascinating. Like, I mean, so and partially related to that they're not doing that much. Like, in some ways, this is just a grift as far as like, I think of it. Just like, it's just a way of funneling, like, particularly state money down to the right to life movement, because they're not doing very much and there's not a lot of transparency about what they're doing or how they're getting reimbursed for it. But like in most states, or here, at least in Texas, then there's like a umbrella organization that gets the money from the state and then it farms it out to all the actual individual clinics. And so that sort of barrier is what like prevents or at least like impedes transparency about like where the money's really going and what the outcomes really are, like you would have in any other sort of situation with state funding, because like it's only on that first level that like the government has like a direct relationship. So that's a huge part of this, but I know it's like a sort of complicated, but can you talk about that?
Yeah, I mean, the lack of transparency for the public funding, for taxpayer funding, is particularly outrageous. the majority of the money that is funding this the industry at this point is private funding from foundations, but an increasing amount of that is coming from state appropriations. We've also identified that you may live in a state where the state doesn't appropriate money to UPCs, like Colorado, but there are counties in Colorado that are appropriating money to UPCs. They're operating in this sort of weird regulatory gray zone. It's very hard to track exactly how much public funding they are receiving for so many reasons, not the least of which is they kind of have to report that. Now, I don't think that they're necessarily being dishonest, right, on their reporting, because as you said, in a place like Texas, there are 4 sub-granting organizations for the money for the, I think it's now at $180 million that's appropriated every 2 years in Texas to
Taxpayer
UPCs.
money you're talking about. Yeah.
Yeah. Taxpayer
That is
tax
so
dollars.
much money.
Yeah.
It's
God.
great. Well, I think that there was a study that was done. It came out last
I read that.
December.
It was
Yeah,
like nobody knows what they're doing with this money. Like, this is bad.
No. And for every $4 that is spent on women's health care in the state of Texas, one of it is going to these UPCs. One.
Which that actually did lead to like legislative reform in Texas. I don't know if you were involved in that at all, Deborah, but I thought that was pretty interesting. I mean, because we need that in Louisiana, and
Yeah.
We're not giving nearly that amount of money, but even,
but I mean, as a percentage
have that.
here,
Yeah,
yes, exactly. I mean, like I don't know. We could do the math pretty easily on whether it's equivalent in terms of the percentage, but regardless, I mean, it's millions of dollars here as well.
Yeah.
Oh, yeah. Yeah. And I think in Texas, so Texas is a good example just because of the scale, right, of how much money. It's also a good example because it's been a program that's been funded for about 20 years, right? So if we want to better understand what is the impact of this industry on addressing infant mortality, maternal mortality, let's look at a place like Texas, where this program has been around for 20 years. And is Texas, what sort of benefit or impact have these clinics had on maternal mortality and infant mortality?
Right.
And I would say it's not been great, right? Like Texas has one of the worst maternal mortality rates. And for whatever reason is continuing to fund these organizations. There's been no impact study how this funding is really being, what sort of impact these centers have on the problems they claim to address. The only impact study that has been passed by a state legislature at this point is in New York. They don't fund, the state doesn't fund UPCs in New York, but they did do an impact study just to understand sort of what could be the possible benefits and what are the harms of these centers. And they passed that bill, gosh, it's been about three years ago. One UPC that's run by Catholic nuns sued to block the state from actually completing this impact study. And I think, and the result of that was they were exempt from participating in the survey, but all the other ones, all the other UPCs had to. And that report is supposed to be released soon, so we'll find out a little bit more.
Yeah, so I was going to say, what was the result? And I mean, it is a little bit different from the nuns' perspective. Like if the government isn't funding you, but like overall, then like just a lot of listeners will sort of intuitively understand this. But like this is like all of us in the nonprofit world. Then if you're privately funded, you need to be reporting to your funders. Like, what are we doing? What are the results? Like, can we justify that what we're doing, is having any sort of impact on our goals? And then from a taxpayer standpoint, like, obviously, if you're getting taxpayer money, state or federal money, then you should be required to do that. Basically, the CPCs are not doing that because, again, of this sort of 2-tiered structure. There's no way it provides a way for them to prevent any sort of real accountability with the taxpayer money, at least, about like what's happening. Like, what are you doing? What are the outcomes? Is this helpful at all? And like, that's just, and like the parts that is the the nuns is like a little bit telling, but I have a little bit more sympathy since they're not getting state money. But like here and same in Texas, like they fight that tooth and nail. Like any sort of legislative efforts here to like be like, okay, like we just like, this is just a bill that's like, we just need to know what they're doing. Like, what are they doing? And like, is it helpful? And like, what are the outcomes? They fight that tooth and nail, which like, it's like messaging bills, I think are very effective because the bill always fails. And
Yeah.
like,
They haven't-
well, if you could justify what you were, that there were outcomes that were, like,
Wouldn't you want to shout it from the rooftop? Yeah.
Right. Every nonprofit knows that. Every nonprofit knows that you have to find a way to justify your work. So like, this isn't weird. This isn't like, oh my God, how would we ever do that? Like, and they will not do it. And they're like, don't make us. It'll be the ruin of our organizations. That's very telling that like, this is a grift.
Oh, 100%. And for what it's worth, of all of the attempts to sort of try to hold this industry accountable, there have not been a lot of attempts to really just advance an initiative around transparency for the funding, right? So a lot of, I think, campaigns have really focused on, let's just stop funding them or shut them down, which, okay, that may be the answer. But at this point, this is now an industry of thousands of organizations. I think simply shutting them down or not funding them may not be the best step to take without more information. So starting with, we just want to know more about what they're doing. And that was the message that was used this past session in Arkansas, where a legislator did advance an amendment, require some transparency for the money that was being appropriated to these centers. She just said, look, I think these organizations, and there's you can watch the hearing with her talking about her bill, but she said, look, maybe these centers are doing great things. I don't know. Well, I just want to understand sort of what they are doing.
Yeah.
So as a legislator tasked with trying to figure out, how do I fill gaps where there may be some maternal health gap, reproductive health gap? I want to know what they're doing so we know how to address where there's a gap otherwise in the state.
Did that pass?
Yeah.
All right. Interesting.
Anna, we have, as far as we know, this is all the sources of funding that these unregulated pregnancy clinics are getting. So they were getting money through what we've referred to as TANF. This is the Temporary Assistance for Needy Families. So most people will recognize this as welfare, right?
Welfare,
right,
welfare from the federal government. The money the federal government gives to the states that like was traditionally welfare. Yes.
Yes. Yeah. So there's a couple of goals of that program, that federal program, that the pregnancy centers kind of convinced states that they could achieve. And preventing out of wedlock pregnancies. I'm like, but you're encouraging out of wedlock pregnancies. So that doesn't make any sense.
Or you're encouraging out of wedlock births.
Yeah. And then some stuff around parenting, blah, 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 whatever. So they were getting a lot of money from that. And then they got nervous that the TANF money was going to get cut off. So now they've been seeking like general fund appropriations, and they've actually increased the amount in Louisiana that they've gotten in the past couple of years from the general fund.
With the trigger ban, then we're in a real crisis here, Debra, with with abortion being illegal. So like the same fucking people, of course, who were responsible both on the lobbying side and the legislator side, the same people were responsible for making abortion illegal, now are going to legislature saying we've really got to support women and families by funding the UPCs. It's like, I mean, it's just like, so like adding insult to injury.
Let's create the problem and then we're the solution. Yes.
Create the problem, we're the solution. And also, which is a grift. Create the problem. And then the solution is like, just like, give us money that we're channeling into whatever. It's like enough to make you just like want to kill yourself. Yeah.
Right.
Go ahead, Michelle.
In Louisiana and many other states, I don't know how many, Debra, you may know, people can, when they get a license plate for their car, get the Choose Life license plate so that you can brand your car with your like anti-abortion position, which is ridiculous. So that money is also supposedly going to UPCs, although it's actually going to the Louisiana Right to Life, and then they are supposed to be subgranting it to UPCs. There's literally no reporting on this, like at all, other than the state just transfers that money over to the Louisiana Right to Life every year. And, I guess praise for the best. And then individual legislators can appropriate some discretionary funds through the budgeting process for pet projects in their communities. And there's a handful of legislators that will like give $20,000, $30,000, $15,000, whatever to the UPC in their community. So there's like so many different sources. It's really hard to keep track, but literally none of them are transparent, have any accountability, any oversight, any reporting.
So the main thing we were talking about in like with the TANF funds. So like, again, that's money, that's federal money that's coming to the state, but that the state could do, I mean, not whatever it wants with it, but the state could do a whole host of things with it. The state is deciding with that money, with those federal funds that it's drawing down, who to allocate it to. So they're allocating tens of millions of dollars of that funding to the UPCs.
Well,
So
they're giving it to the states as a block grant, and then the states
that's
are
what I
doing
mean.
that.
Yes. So in other words, it is zero sum like that. What's the number that of that funding right now that's going to the UPCs?
In Louisiana, it's been about like anywhere between 1.2 and $1.5 million has come from TANF.
Okay. So that money could go to something else that was actually helping. Yeah. And then that's the money that like is like going through this sort of two-tiered system where there's also like no accountability, right? Where it's like there's the top level that it goes to, and then that organization does no services. It just subgrants, right? And so then, Deborah, I don't know. I'm assuming that's common everywhere. I know it is in Texas, but it's again sort of an ingenious system, that makes transparency much more difficult. The initial organization that gets the money, its only function is to subgrant. Why are you doing it like that?
Right. If their only function is to subgrant, which means that there's no real accountability for state regulators on who's responsible for ensuring that anything useful is happening here, who's responsible for oversight of what's happening here, who's responsible for something going wrong. It shifts that responsibility outside of the government. So now your tax dollars are going to fund these organizations that have zero accountability from the state, that are not subject to health and safety inspections. You were talking earlier about other types of services that have to be licensed. I mean, if you were to consider other businesses, like, I don't know about Louisiana. I know here in the DC area, if you go to get your nails done at you'll see like a health and safety inspection certificate on the wall. They are subject to health and safety inspections by the state government. They are these organizations that are conducting transvaginal ultrasounds on women.
That's what I was going to say. That's what I'm saying is that they're going to say, like the reason for the nails is like, there can be infection. They're like jabbing into your cuticles.
They're working with like harsh chemicals, right? Exactly.
Yeah, right. But same with a transvaginal ultrasound. Like, there's potential
like completely
for
unlicensed, unregulated people getting clients into a room, getting them to, maybe take their clothes off.
And inserting instruments. Yes. Yep.
Oh my God.
What could go wrong?
There are some states, like I believe Texas is one of them. I don't know about Louisiana. I know Texas for sure is one of them, where you have to have a specific kind of veterinary license to perform an ultrasound on livestock. But you don't have to do that to perform an ultrasound on a human woman.
That's probably true here.
Wild.
Wow. I'm sure that's true here. And that's
exactly.
Up.
It has to be true here. I mean, livestock that is more valuable than women in Louisiana for sure. There's no doubt. The health and safety of livestock. Come on, there's money in that. So before we move on to some of the like HIPAA and privacy stuff, then so it sounds like that like their state money is particularly disturbing to folks like us. I mean, like by me and Michelle, that like I mean it's taxpayer money with no accountability, but it sounds like that there's a ton of private money. There's more private money that's going into this. And is it also going to that top layer where, that is sub-granting? So there isn't really any transparency with what happens and what if, so that's question one. I'm big on two questions combined.
Ellie's the queen of compound questions.
I am,
Sorry.
it's true. Yes, objection, compound, yes. And second part being that, why or how is that happening? Like with so much private money going into those organizations as opposed to like other, just like the other 501c3s or 4s that, are associated with the right to life.
Yeah. Okay. So on your first question, the private money is not going to those third-party contractors that sub-grant from the state. That the private money is not going there. The private money goes directly to, in some cases, it goes to organizations that service multiple pregnancy centers, like an organization like Save the Storks, right? Which their objective is to go in and give your UPC a remodel to make it look like a medical center.
There's a guy, hold on, Deborah, there's a guy who climbs buildings. They call him like pro-life Spider-Man. He's on social media and he has set up his own little charity to climb buildings. People donate, like money to him to encourage him to climb a building. And then he donates that money to like these unlicensed pregnancy centers. So there's all kinds of stuff like that.
Oh yeah,
that's bizarre. But it's interesting. So they go either to the individual clinics or to like specific organizations that are servicing or whatever, funding, which is interesting to me, like as compared to the state funding. Like why is the state doing it that way? Individual people know not to do it that way. That like the only way you figure out is my money useful is by sending it to the people doing the work.
Well, but the other thing that they're doing, right, Deborah, is that, and they did this in Louisiana, is that now they're, giving tax credits to people, like encouraging donations.
Yeah, there are in several states now. So 21 states are providing state funding. And then there are a host of states. A big push from Susan B. Anthony list over the last few years has been around these special tax credits for pregnancies, for UPCs, which are bizarre, right? Like there are no other organizations, I think, that have been singled out in that way.
Yes, right. But to be clear that like, I think it's more politically like feasible. I mean, first of all, it's just a secondary source, right? But also because like, who doesn't like a tax credit, right? But the reality is that it's exactly the same, is that it's the government giving up money that they would otherise receive.
Yeah,
to funnel it to these organizations. Exactly.
Yeah. That is lost revenue for us.
Yes. You as a person who are, giving that donation, you would like, sure, you would otherwise have to pay taxes on it. So that's why people are like, oh, that's so great. But like the government is giving that up. So it's really the government's, it's like me being like, it's like forgiveness of a debt, basically. It's debt forgiveness on the part of the state in favor of the UPC. So it's really no different than actual state funding.
Right. And it has even less accountability, right?
Right. That's true.
Even if you were to have accountability for the grants.
Right. Because it never exists. It basically just doesn't exist. Yeah. It's like you get the credit. No, it's on people's individual tax returns then.
Yeah. And I think that ProPublica did really great reporting on this in Missouri. Missouri was a bit of a pioneer, I would say, in this legislation. And legislators were, I think, really caught off guard when they found that after, I think it was maybe 2 years into the program, funding for these centers went from, I think, $5 million, to relatively modest amount of money, to more than $10 million over, like just in 1 year, which was crazy. They were not prepared for that. And they had no idea that state revenues would be redirected in that way.
Which, right. Because I mean, they didn't know how much money was being given at all. people obviously that there's a benefit then to you as a donor to a charity, but like that what I've seen from sort of like Mississippi, Missouri also is just that the state just had no idea how much money they were giving up. Again, with the debt forgiveness, that
Yeah,
it was
but then
that
they
it's
kept
like
coming
in the
back and they were
tens
like,
of
oh,
millions
this
of
has been,
dollars.
yeah, but they came back and they were like, this is like in Mississippi, I think. They were like, oh, this is so successful. Instead of a $5 million tax credit, we're going to do a $10 million
Yes.
tax credit.
Which again, though, where there's also still no one is either requiring or these folks can't provide the evidence of what's the fucking benefit. Like,
Yeah.
what are they doing? That's helping people. Maybe they're giving people some diapers. Maybe they're directing people to social services. Maybe, which as we know in Louisiana, on the latter part is a real maybe, whether they're even doing that. And otherwise they're doing free ultrasounds. Okay. I mean, that's
Well,
it.
they're not doing that. I mean, yes, they're saying they do these free.
They're not
free ultrasounds.
diagnostic. Yeah.
They're not diagnostic. And what's
Sure.
so
They're just
messed up about
gestational
that-
age, right? I mean, that's what they're
Maybe,
telling you. Right.
maybe. I mean, I think
Uh-huh.
that like what's so concerning from a public health perspective, women's health perspective about this is, we've done a lot of research into the clinical capacity at these clinics. We saw, a lot of them, I think more than half of the websites that we have in our database will say that our medical services are overseen by a licensed physician or a medical director. And we went in to better understand, well, who is that? Who is the medical director? Very few of them actually name a medical director. Very few of them name who the licensed physician is that oversees these services. And I think I really would encourage investigation. This is an area that we're focused on, but I would encourage investigation into, is there a doctor in the house at all? Is there any physician that is overseeing what's going on here? Because if you imagine, the people that are going to these clinics, they're poor, they're uninsured, underinsured. They're there because there's really no other place for them to go. So if they think, as any reasonable person would, I am in a medical facility. I had just been given all of this paperwork around to fill out like I would at a doctor's office for my medical history.
Sure. Yeah. It feels medical, right?
Yeah,
like
it feels medical.
It has all the trappings of a medical clinic.
Right. I'm in an exam room on an exam table with an ultrasound. A person in scrubs is giving me an ultrasound, telling me that these are medical services, right? Imagine there's something wrong. Any reasonable person would expect that if I'm at a doctor's office and they see on the ultrasound that there is something wrong, you're going to tell me, you're going to record that in my file. Right. And what we have found is they don't do that. That is not, in fact, they are encouraged by the big national organizations not to do that. So maybe you ensure that this woman is going to carry this pregnancy to term, but you didn't alert her to the possibility that she has signs of uterine cancer,
right,
or other complications.
Or I'm sure, obviously problems with the fetus. Also that, first of all, that a medical professional would be able to tell, maybe not in the ultrasound itself, but whatever, in this process, if you're getting an ultrasound, like someone would be able to read and tell you something, which they're not going to do that. But number one with this, then is there a doctor in the house at all? It 100% reminds me of the licensing here that they did with abortion clinics when there was all this freaking out, back in the early 2000s on the right to life, that, these organizations need to be, or these clinics, which are just like OBGYN offices. They were just regular doctor's offices, need to be licensed. And then you were required to at all times to have registered with the state, who your medical director was and who the administrator of the clinic was. So if the licensing health people in your state don't require that, it's unknowable / maybe not happening. The other thing is, I would assume also that with the ultrasounds, what information they're giving to people, that there's also a huge incentive. And I think I've heard this anecdotally anyway, of course, particularly now, to tell people that they're farther along gestationally than they really are. So that then people are feel like they have fewer options in terms of traveling out of state.
Yeah, I think Yeah, I've heard that anecdotally as well. I think that what may be more likely is that there's no real, within this infrastructure, there's no real expert that's interpreting these
Yeah.
scans.
Yes.
So whether
Right.
they are whether they are doing something, intentionally nefarious, or they're just being naive about the information that they're providing, I think it's concerning that we have no idea whether or not the patients of these clinics are receiving accurate information, accurate diagnostic information.
Right. And which
Yeah,
again, as we talked about, it's under the like trappings and auspices of like a regular doctor's office. So of course
right.
you would assume that like, these people know what they're doing and they're very well trained. And you can be trained to take an ultrasound like without being licensed. You can. Like if you are well trained by medical personnel, you don't have to separately go to school and get licensed for that. But like
No,
you have to be trained. You either have to like go to school and get
yeah.
trained for it or do like adequate on the job training for it. There's no reason to know, much less believe that that's happening at all of these places.
Oh, yeah.
So along these lines, then like let's talk about the HIPAA stuff with Pride. From what I know and have seen, then one of the issues is, of course, these are not medical organizations. Like when there's HIPAA issue, when people complain, patients
Yeah.
complain, that like, oh my God, like my private information was somehow released, which, in any setting, in any sort of medical clinic setting, if that were to happen, I need patient identifying information would be a huge HIPAA violation. Then like the response is that we are not medical clinics. We are not bound by HIPAA. So can you talk about that a little
Yeah.
bit?
Yeah. So they are not covered entities
Yeah.
under HIPAA. Yeah. And
Right.
what caught our attention when we started reviewing the websites and some of the legal guidance that these centers were getting from national organizations, we noticed that a lot of them were saying, oh, our website is HIPAA compliant, or this form is HIPAA compliant, or we abide by HIPAA. In some cases, they would say, if you have some sort of problem, you can go to the HIPAA office at HHS
Which that's
to
not
report
true.
this.
That is going to
No,
be 100% not true. Because again, like
no,
whether you are acting in compliance with HIPAA on a voluntary basis,
right.
maybe. Meaning when they're saying such and such is HIPAA compliant, like maybe that's true, maybe it's not. But right.
Oh,
But
yeah.
like
We can
saying
be
that
HIPAA compliant.
yes, yes. And I mean, as like a lawyer, then like, I mean, the way this works generally is that like medical organizations are covered entities, as you said, like they're people providing medical services, they are bound by it. And then people who they associate with, so like lawyers or like vendors, they're then required to comply based on being like business associates with the covered entity. So like the web
Right.
comes from the medical organization.
It's HIPAA relates to electronic transactions.
Yeah.
So you're collecting money, you're transmitting, there's some sort of electronic transaction with regard to payment or insurance or referring a client to another provider, right? It's not that it follows a medical practice. It's about the transactions itself. And they don't engage in those transactions, which means that they're not covered entities.
If you're providing medical services, because you as an entity are engaged in some of the various things, all of the various things that HIPAA applies to. So as
Yes.
an entity,
Yeah.
you are required to comply. These organizations are not required to comply. So when they're saying that like you can make a complaint to HHS, you can, and HHS is going to tell you we have no oversight or ability to do
Right.
anything about this.
But more than that, I just want to help people understand when you walk into one of these UPCs, these unregulated clinics, right? You go in and they give you a clipboard as if you're walking into a doctor's office,
Right.
and they ask you to put all this information on the clipboard and you hand it to the receptionist, and then that information is entered into their database. And so if you have no idea that you're not at a medical clinic, you are assuming that that information is protected the same way it would be at any other medical clinic. But
Yeah.
Debra, one of the things that y'all found through your investigations was what? Talk about the privacy issues that y'all uncovered.
Yeah. So one was just them making these overtures that they are giving people the impression, their patients the impression that their data would be protected by this law. The other, in the case of Louisiana, I believe there was a UPC in New Iberia that, sorry, let me back up. There was a training for software for UPCs called Next Level that is run by a national organization called Heartbeat International that has thousands of UPCs in its network, not just in the US, but outside the US. They have their own patient information management software that they market. And as part of the training for administrators on how to use this tool, they were using, if you've ever done this before, they usually use phony accounts, right? To show
like
you
a
or
John
lists.
Doe.
Right.
Yeah.
And then so it happened that in the case of this particular UPC in New Iberia, they used the actual names of clients of this center in a training module that was available on the internet for anybody to see, where you had the names of the clients and their expected due date and other services that they had received. Campaign for Accountability filed a complaint with the Louisiana Attorney General's office. I believe it was earlier. I don't know if it was earlier this year or at the end of last year. I'm not sure.
She's busy trying to sue an abortion provider in New York, so she may have not seen it. I don't know.
She may not. She may not. I will say that the Campaign for Accountability, Electronic Frontier Foundation, I think Center for Reproductive Rights as well, have filed complaints with Attorney General in now 16 states, calling on them to investigate what are the privacy practices of these UPCs in your states that say they're HIPAA compliant. And we've noticed that they've taken HIPAA off their websites.
Yeah.
I don't like that. Yeah.
Yeah. Well, that's smart. But yeah, I don't know if it was in conjunction with the same clinic here in Louisiana or a different one. I don't remember the exact details.
Somebody called us at Lift Louisiana, just cold called us, and they had unknowingly gone to one of these UPCs, and they got through the whole process, or like halfway through the process, before they realized they were not where they thought they were. And they were really worried about now this place has all of my information. They know all this stuff about me. And I'm still trying to get out of the fucking state to get an abortion. And now they know my last menstrual period, my dude, all this information about me. And how can I get that wiped? It was very, I was like, there's nothing, honestly, you could do about it.
Yeah, I guess that makes sense. Then it would have been in the context of me being like, and there's nothing that prevents them from disclosing it to whomever in terms of, but we've talked about here proposing legislation that I think would be good here and in general, that in fact they need to have a disclaimer that says we are not bound by HIPAA.
They need to tell people that in writing,
we're
and
not. Yeah, this we are not a covered entity under HIPAA.
Right.
Hopefully in a little bit more layman's terms, but something along those lines. Because again, whether this is on the website or not, all the trappings of this, people just assume. And people actually are very familiar with the term HIPAA. I can't tell you the number of times that people are saying to me in all sorts of different contexts, isn't that a HIPAA violation? Isn't that a HIPAA violation? I'm like, actually, no, or actually, yes, but there's no private right of action under HIPAA. People know about HIPAA. People are still, even if they're not using the words HIPAA, people are going to have the sense that this is a space where what I say and what information you collect can't be released.
Right. And you can say, you could pass policy that requires them to disclose that HIPAA laws don't apply to them. You could also pass policy like they did in Washington with the My Health, My Data that extends HIPAA protections to organizations that are not otherwise covered entities.
That's smart. That's smart.
Because the state law has greater protections than the federal law, that the state law would be the one that would be like it wouldn't mean that HIPAA, that HHS has to hold this center accountable. It would mean that the state is within its rights to hold that center accountable for violating.
So meaning so then you have to have a whole oversight apparatus on the state level. So we're not gonna be able to do that here. we ain't got no money for that kind of shit in Louisiana.
Well, I mean, maybe we would if we weren't giving $5 million
That's
to
true.
these,
That's true. That's true.
UPCs in the first place. All right, I want to play a game with y'all.
Yeah, that's what we do.
All right, so we are going to play a game called Is it an abortion clinic or is it an unlicensed pregnancy center? And how this is going to work is I'm going to read off the name of some entity and y'all can just say, shout it out. There's no prizes here. It's just an illustration of how confusing it might be for people who are trying to figure out, is it an abortion clinic or is it a pregnancy center?
Before we start, I think maybe just in case people don't know, then historically, what UPCs did is that they would set up shop literally right next to abortion clinics. And they have a name that's similar. They always pick a name that's very similar to the clinic's name, the abortion clinic's name. And the point is literally to trick people into coming into their door instead.
Thanks for explaining the relevance of my game, Ellie.
You're welcome.
I appreciate that. This is me exercising my aging out of fuck in real time. All right. So our first one is an easy one, I think, for y'all. Whole Woman's Health.
That's a fake clinic. Oh, that's a UPC.
No, it's a real clinic.
It's a real clinic.
That was the name of that was the lead plaintiff. That was the lead plaintiff. Yeah. But it could be, right? Yeah.
It's hard, right? Yeah. Okay.
In the 2016 case.
That's right.
But anyway.
That's right.
Yeah.
That's right.
Texas.
Women's Resource Center.
UPC.
That is the UPC. That's correct. Okay. Your Choice Healthcare.
UPC.
Yeah, I think so. UPC.
It's not. That's an abortion clinic.
Oh my gosh. I bet there is a Your Choice Healthcare.
Yeah,
I know, right?
But the only reason it would be a UPC is for the reason I would just say, if you're trying to do the bait and switch.
Yeah. Okay. A Woman's Choice Healthcare Clinic.
Abortion.
Oh yeah, Reproductive Health Center.
It was. That's an abortion clinic. Okay. Women's New Hope.
Abortion.
I'm going to say UPC.
It is a UPC.
I should have known that, actually.
All Families Health.
Ooh. Tricky.
Yeah, it is tricky. I'll go abortion.
Yeah, I'll go abortion too.
It is abortion. Good job. All right. Hope First.
I'm going to go UPC.
I know too much about these. Like I know that. Yeah,
you're like, I know this one. Okay.
Yeah.
It is. It's a UPC. Okay.
I think the Hope ones are gonna be UPCs. That's I feel like. Are there? Help Medical Clinic actually one of the main abortion clinics in our state. So never mind on that. One of my longest time clients has Hope in their name. So yeah, never mind on that theory.
Okay. Your Choice Clinic.
I'm going to say UPC.
Yeah, me too.
Yeah, it is. Okay. All right. Last one is A Woman's Choice.
UPC.
I don't know. I might say abortion clinic.
It is an abortion clinic. So
it's tricky.
It's tricky.
Yes. By design.
That's why people wander into the wrong clinic and then they're like, holy shit, I filled out this form.
Right. Particularly if it's right next door and they have a sign that looks like the same, color and lettering and also has a similar name.
That's right.
In some cases, they have someone standing outside in scrubs like, oh, okay. Are you here for your appointment? Just come on in here. They'll usher you in.
They're sick.
As someone who is like always running late and like that I constantly tease that like the hardest part of like basically anything I do is like getting from point A to point B, like just the like
You're
getting there.
100% their
I
target,
would
Ellie.
go into the wrong place for sure. I would be on my phone. I would be running late. I'd be like, great, awesome. Okay. Thanks for being out here telling me where to go. Like I would, yeah, I mean, 100%. Yeah.
Oh my gosh. All right. Well, listen, Deborah, this was great. We've kept you for a long time. I appreciate you muddling through our technical issues. How can listeners support the work that you're doing at Reproductive Health and Freedom Watch in their own communities, regardless, you know, of where they live and like what their own kind of political background is?
Yeah. So wherever you live, whether it doesn't have to be a state that's funding these a UPC, but wherever you live, I think that alerting people and alerting other women, girls, so the girls are also targeted by UPCs in your community, that these the clinics are not required to maintain confidentiality or protect your privacy, that there may not be a licensed medical provider inside the building or a licensed medical provider overseeing whatever medical services are happening inside the building. Getting the word out that that's the case is certainly important. I think that a lot of these centers also rely on word of mouth to sort of validate the services that they provide and their brand. So I would encourage you to contact the UPCs in your to ask, who is the medical director of this UPC? Is there a medical director? Is there a licensed physician in the building? And if the answer is to any of that, no, post it on a Google review for that
Yeah.
UPC, a Yelp review, so that folks
Yeah.
know that there's no real doctor in there, which is super, super important.
That's
It is
such
super
good
important.
advice.
Yeah, it is good advice because, like, aside from my joke about that, I would easily get confused when trying to walk to the appointment. Like, I mean, I very much personally know people in my own life. I mean, who are very well educated, like would have done their own due diligence, who have made appointments at a clinic like this thinking that it was an abortion clinic only
Yeah.
to learn once they're there and then an hour into being naked in a medical exam they're like, oh wait, this is not what I thought was going to be happening. I'm not
Oh,
getting
yeah.
like the information or advice that like I thought I was signing up for here. So I mean, like it's really actually quite easy for people to get tricked by this. Something that's like on the internet like that would like alert people, that like this is not where you think that you're making an appointment, I think is really useful.
Yeah, and whether
Yeah.
you're in a state that has access to abortion, bans abortion, I've talked to people out in parking lots outside UPCs in states that have banned abortion, fully pregnant, like 8-9 months pregnant women who
Yeah.
come out of the facility, and I ask them, what sort of services are you getting in that facility? Who tell me, oh yeah, that's my doctor. I happen to know that there's no doctor in that building,
God,
right?
oh
So
my
I'm not
God.
sure what sort of services they're getting.
Wow.
Again, the people that go, the women, in some cases girls that are going to these places they're poor, they're uninsured, they're underinsured. They're looking for, where can I get free services, free care for my pregnancy? They think that they're getting that care inside this building, and they may not be.
Well, I mean, if those people like are not getting like other prenatal care because they're under the
Yeah.
impression that like this is their doctor, like that's incredibly disturbing.
100%.
Regardless of whether those centers are actually giving them some diapers and giving them a referral to, like Medicaid or whatever. Again, these people make it seem like they're doctors. You might think you're getting prenatal. You keep coming back and, every couple
Yeah.
months they're checking on you and they're like, you're doing great. You're still pregnant. That's all we care about actually, is that you're still pregnant. They're not doing anything to, nor do they have the ability to give you any sort of like actual care. That's I never thought about that. That's really
Oh
disturbing.
yeah. It's very concerning. And I would say, look, I think a lot of the people that are volunteering or donating or participating in some way with these UPCs, they're well-intentioned people that really just want to help poor women and in their communities.
Right.
That's great.
They're ideological, but they mean well. Yeah.
They mean well. So if you want to do that too, then ask your OBGYN or the free community clinic in your community if they have a pantry, a diaper pantry, a baby clothes pantry, if there are things that you can donate for them to have on hand for clients that may need extra help.
Yeah, that's
Yeah.
that's great advice. I love that. Debra, we really appreciate your time. This has been an amazing conversation. We will put a link to the website for your organization and social media and all of that blah de blah in the show notes. This has been great.
Thank you.
Yeah.
Thank you for all you guys are doing. I really
I'm having
appreciate
a
it.
coughing attack, but yes, thanks. Thank you so much, Debra. And thanks to all of our listeners. Michelle, you take it from here.
Oh, okay. All right. So Ellie's having a moment. So I will
I'm
just say
sick.
that
That's my moment.
Ellie and I are going to figure out whether we're going to do another episode next week. But until then, please rate, review, subscribe on all of the things. You can watch us on YouTube. We'll talk to y'all again soon. Thanks so much.
Thanks, everybody.
Seriously is presented by Lift Louisiana, a nonprofit organization advocating for reproductive health rights and justice.